All right. Thanks everyone for joining this press conference this morning. This call is being recorded and will be distributed widely after it wraps. In just a second, I'll hand things over to Senator Murray. After each of our three speakers on the call have given their remarks, we'll have time for questions from any members of the media in attendance. And during Q&A, we'll ask folks to use the raise hand function and say their name and outlet. So with all of that, I'm going to go ahead and turn things over to Senator Murray.
All right, well, thank you all for joining me here today. We are here to put a spotlight on an issue Republicans are trying as hard as they possibly can to ignore: the healthcare crisis they have created, which is forcing people to lose their health insurance, hospitals to close their doors, and will soon mean millions of Americans will pay more than double what they pay now for their healthcare premiums if Congress does not act. Seriously, Republicans have decided they would rather shut down the government than talk to Democrats about preventing premiums from exploding next year. One big issue with that Republican plan: ignoring or lying about it. This problem is not going to go away. Families with health care at stake know this all too well, because when you go online to buy health insurance and find your monthly payment has more than doubled, you're going to notice it. When your health care is suddenly cut way out of budget for your family, that's not something you will ignore. In fact, it is something that will break the bank for many people and force millions to simply drop their coverage altogether. I don't know why Republicans think they can just sweep this healthcare crisis they created under the rug. But we are here to say we are forcing this issue. We are going to talk about healthcare, whether Republicans want to or not. And it's clear as day they do not, because they know their position is unpopular. A top House Republican recently said as much in private and urged colleagues, don't talk about it. So Democrats are going to force Republicans to come to the table to negotiate with us. The American people are demanding action, and they are demanding it now. Why? Because the new higher healthcare rates, those are being set right now. Notifications to families, they're in the mail now. Open enrollment is weeks away and families are panicking. I have heard from one family in my home state of Washington whose premiums could jump from $278 a month to as much as $1,800 a month. There is a simple solution here: to simply save the ACA tax credits that 22 million people rely on to afford health care, including over 200,000 people in Washington state. But Republicans have made clear they would quite literally shut down the government rather than address this problem. What do they plan on telling farmers? That a quarter of them are enrolled in the healthcare exchanges. They will see their costs increase exponentially. What do they plan to tell small business owners and workers and people who are self-employed, half of whom get their coverage through the ACA exchanges? Because saying tough luck is not going to cut it, and neither is we'll fix it later, for that matter. Later is too late. Republicans are saying they will just sit on their hands until those higher rates are locked in for the next year, and that is unacceptable. We have to act now. Families know it, patients know it, small business owners know it, and that's why Democrats are insisting on acting now. We are not going to let Republicans keep sabotaging Americans' health care. Democrats are fighting to reverse the cuts, lower costs, and protect health care for the people we represent back home. People who are speaking out about just how devastating it will be if Republicans refuse to save these critical health care tax credits. I am joined by some of them today. Republicans may shut down the government, but they're not going to shut down this debate. And they will not shut out the voices of people across the country who want us to act before their health care costs skyrocket, before their insurance is out of reach, before it is too late. So with that, let me turn it over and thank Commissioner Patty Cooterer for joining me today.
Thank you, Senator Murray, for your leadership and for pulling us all together here today. So my office oversees the individual health insurance market. This is the market where people buy coverage if they don't have employer-sponsored coverage, and it's also where many people who are self-employed and early retirees get coverage. I'm proud of the work that Washington State did to implement the Affordable Care Act. Because of this effort, we enjoy a robust, competitive individual market and a historically low uninsured rate of 4.8%. We achieved this success because we embraced Medicaid expansion and because we helped people buy coverage through premium tax credits. Last year, more than 216,000 people in the individual market qualified for enhanced premium tax credits. Simply put, tax credits are crucial for helping people afford and keep coverage. This year, insurers requested a 21.2% rate increase. We found that 21% was justified, and state law requires us to approve that rate change if they can justify their request. Up to 7% of that increase, however, is due to the expiration of the enhanced premium tax credits. And I want to be clear, that's just the base rate increase, not the net increase that people will see. And I want to be also very clear that people are going to find it very hard to absorb these increases without financial help. Our exchange predicts that 80,000 people will drop coverage if enhanced premium tax credits are not extended. If fewer people are enrolled because of cost, older and sicker people will remain, driving up costs for everyone. And this, along with the growing uncertainty at the federal level, does not bode well for the next year. And as your insurance commissioner, I can tell you what insurers do not like, and that's uncertainty. Uncertainty does not create a stable, vibrant, competitive market. It creates chaos and high costs for consumers. It's time for Republicans to stop playing politics with people's health care and make these premium tax credits permanent. And now you'll hear from Maya Tusing, a Washington small business owner who relies on the ACA tax credits to afford health care. Maya?
Thank you, Commissioner Cooterer, and thank you, Senator Patty Murray, for giving me this platform. Her commitment to highlighting healthcare stories of Americans is very important. My name is Maya Tusing. I live in Woodinville, Washington, with my husband and teenage daughter, and grew up on the east side of King County. And 6 years ago, I launched a small business with a partner that helps nonprofits manage their financial resources. We're lean, we're mission driven, and we're growing. And most importantly, we are passionate about what we do. However, we're not large enough to provide me and my family with employer-sponsored health insurance. And that's why the ACA was a lifeline for me, because it allowed us to focus on building our business without my agonizing over how to secure health insurance. And at the time, it seemed like a stroke of luck and an example of the US's brilliant policy innovation. And it sounds a bit sappy, but it was the first time I really felt fortunate to be an American because of the incredible dynamism in this country and the fact that everyone here is so supportive of small business owners, and it seems so easy to launch a business. But while our take-home pay grew steadily, our healthcare premiums spiked. And last year, they increased fivefold. And with the expiration of tax credits, they'll double, making it a tenfold increase in 2 years. And our healthcare costs could cost more than our home, life, and auto insurance combined. So running a small business requires reliable expense forecasting, and that means that if these credits expire, many entrepreneurs will face sudden premium spikes that they couldn't have anticipated. And that kind of unpredictability can be devastating, especially when it's driven by policy decisions that are totally beyond our control. Now, I'm more fortunate than most Americans in that I have an MBA from the University of Washington that allowed me good paying jobs, that allowed me to own a home. I fully funded my retirement. I saved enough to bootstrap the small business that I run today, but I was totally unprepared to squeeze an additional $1,000 a month just to keep my existing health plan. And while some Americans may lapse coverage, I cannot. I have a family I care about, a business partner and 2 employees who count on me to show up to the office every day. And if things get desperate, I could tap my IRA, but I'd pay penalties because I'm far from retirement age, and taxes just to afford the premiums, and that's not sustainable or fair for that matter. And after that, my family'd have to scrutinize every dollar toward care. So, for example, does my back hurt enough to go to the doctor, or do I really need that MRI? So families like mine are bracing for higher premiums, deductibles, and copays, and then we'll be forced to ask ourselves, how sick do I have to be before I can justify paying for treatment? And that's not how healthcare should work in the wealthiest country in the world. And this is the moment for Congress to act. Let's protect the people of this country now. Handing it back to you, Senator Murray.
Thank you. Thank you to both of you for sharing your perspective. And I will turn it over, Naomi, to you to call on any press.
Thanks, everyone. We now have some time for questions from reporters in attendance. To kick things off, we'll go to Orion with the spokesman review.
Thank you, Naomi, and thank you, Senator, for doing this, to everybody on the call. Senator, I talked yesterday with Dan Newhouse, who, of course, is not one of the negotiators on the GOP side, but is an appropriator. He suggested that he and other Republicans would be open to some kind of middle ground on ACA subsidies, perhaps extending them but tapering off, or reducing eligibility for higher income earners. Is that something you and Democratic leaders are open to?
Look, we are open to a discussion on how to get this done so that we can get it done in time for it to make a difference for people who are going to see these exorbitant costs. But what Republicans are saying to us so far is just open up the government, we'll do it. And we have seen this talk for 9 months now where, don't worry, we'll take care of it. And then Trump says don't, and they don't. So we need to have them come to the table, negotiate with us, and get this done on this bill before it's too late.
Thank you. Just a quick follow-up. If GOP leaders stick to their current line and are not willing to negotiate, how long are you and your fellow Democratic leaders willing to hold your line and not reopen the government?
Well, I think the question I will put to you in reverse is how long Republicans want to hold the American people hostage because they don't want to fix a healthcare crisis that is in front of us today.
All right, thank you.
And next we'll turn to Celine, if you can say your name and outlet.
Yes, hi, my name is Celine Stevens. I'm with KGW News in Portland, Oregon. Again, thank you for taking our questions. This is a little bit more broad. Do you know how many Washingtonians would be impacted, one, by this government shutdown, and then also by, as you called it, this healthcare crisis, just numbers for both of them?
Well, I can't answer the first, but I can tell you, and Commissioner Cooter can probably answer better than I can. Just on the ACA tax credits, I believe there's over 220,000, Patty, that will be impacted by this.
There we go. Yeah, we have 216,000 people. That's over 3/4 of the people on the exchange that get that qualify for enhanced premium tax credits that will be impacted by this.
That's the direct impact I want to add. The fact is that if we lose that many people on the healthcare exchanges, people still get healthcare, and providers, hospitals, doctors are telling me these people will still show up. They will become uncompensated, which means everybody's health insurance, healthcare costs will go up to be able to cover those. We have seen this before when the ACA, when we passed it, the uninsured rate in Washington State was over 15%. When we passed the ACA, which we're talking about now, it dropped to less than 5%. So that many more people being covered meant everybody's costs went down.
Thank you.
And now we'll go to Aaron with BGov.
Hi, thank you, Senator, for holding this. I was just curious, especially because both you and Senator Collins on the Appropriations Committee are known for reaching across the aisle. Have you been able to have conversations with her about the premium tax credits or kind of finding a way forward out of this shutdown?
I think both of us have been very clear that we need a bipartisan agreement. I am talking to her, and I know she wants that as well. But what we need is for our leaders, for Leader Thune and Speaker Johnson, to speak to our Democratic leaders. They have refused to do that for months now. We have been telling them at our level we can get things done, but we can't get it done if Speaker Johnson isn't going to let the appropriators move forward.
And just to follow up on that, so it sounds like you've been saying that to Republican leaders. Has Senator Collins also been carrying that message to her leadership?
I would like her to answer that on her own. I don't want to answer it for her.
Okay, thank you.
And now we'll go to Matthew with Washington Post.
Hi, Senator. Thanks so much for joining us. Could you maybe talk about where your line is in terms of what would get you to, vote to reopen the government if the Republicans were to issue some kind of verbal commitment or something like that to include extensions for the ACA subsidies, or does it really have to be included in whatever kind of CR mechanism that ends up
I
being
can
used to
speak
reopen the
for
government?
me. A verbal commitment is let's just open government and we will take care of this later is not good enough for me. We have been seeing this for months now. Don't worry, we're going to do this. We'll pass appropriations bills. We'll get them out of conference. We'll get them to the president. And all we've been told is next week, next week, next week. It isn't completed. So it is not good enough to me on the appropriation side or on the ACA side is let's just open government. We'll figure it out later. That is an empty promise that this president himself will turn on.
And we'll go over to Savannah with the National Journal.
Hi, Senator. Thank you so much for doing this. I was just hoping to get a quick reaction to the threats coming from Russell Vogt on some of these perhaps mass layoffs that we could be seeing, and perhaps some of them could be permanent. So just hoping to get your reaction to that bit of news.
You know, this is not time for kids to be fighting on a playground. Russell Vogt uses taunts, so does the president. They use threats. Why do they want to hurt the American people? You would think if they wanted to do the right thing for this country, for the people in this country, they would work with us to solve these problems, not threaten people. That's not how you solve anything. And that kind of level of taunting and scaring people, we just, keep scaring people. You've been doing it for 9 months. What's different?
And now we'll go to Jake with the Washington State Standard.
Hey, thanks for doing this. First, Senator Murray, I was just wondering, separate from the subsidies, what impacts you've heard so far to the WIC program in Washington from the shutdown or nationally more generally?
Well, I know the president and Vogt like to threaten everybody about that. The fact is that there are funds in place right now for us to currently providing WIC, unless the president decides to just really be mean and shut it off. And we will work within what we have to make sure that doesn't happen. But we have seen this president. We know what he does. But you don't get your way by taunting and scaring and threatening. You get your way by sitting down and working with people. And frankly, that is what we've been asking the Republican leadership to do, is don't put in front of us a partisan bill that you've not even talked to us about, that does nothing to address your concerns. Turn around and say, we need Democrats to vote for this, but don't give us anything to vote for.
And just a quick follow-up, when you say funds in place, is that the contingency? I think it's 150 million.
I don't want to speak to specifics on that. Let me see if I can get that to you, but I don't want to give you misinformation at this point.
I appreciate it.
All right, I'm not seeing other hands raised, but I'm going to give another minute if anyone has another question they'd like to ask. You can either raise your hand, or if you weren't able to do the raise hand function, you can go ahead and unmute yourself. And we'll go back to Orion.
Thank you. Yeah, if you don't mind, just one more. Senator, I wonder if you are open to separating the ACA subsidies from the Medicaid provisions from the, in the GOP reconciliation bill.
Yeah, I'm
For
not
you,
gonna,
did these?
I'm not gonna, I'm not gonna negotiate with you at a press conference, but I will tell you what needs to happen is Thune and Johnson need to turn to our Democratic leaders and sit down and find out where they can find a place of agreement that assures us that they're going to take this crisis seriously.
Boy, it would help me if you would negotiate with me in a press conference,
Oh,
but I understand.
okay, you bet.
Thank you.
And we'll go to Selena Simmons-Duffin with NPR.
Hi, I have a question about Medicare waivers that enable hospital at home and telehealth. Since I understand they lapsed yesterday, September 30th, I'm wondering if you can speak to how that might be playing out and how that might be affecting people now.
Well, the extension of that is included in our Democratic CR that we are offering. I believe it is in the Republican as well. So we will do everything we can to work that out.
All right. Last call for questions here. If you were not able to use the raise hand function, you can unmute yourself. I'm just going to do last call. Great. Not seeing any other questions, we're going to go ahead and wrap. I'm going to turn it to Senator Murray to close us out.
Thank you so much. I mean, the answer really is simple here. Republicans need to work with Democrats to solve this problem before it's too late. We do not want to shut government down. We've been offering and saying we're at the table. We're here for weeks now. We need the Republicans to come and work with us. That's what's going to solve this.